November is Lung Cancer Awareness Month, and Dr. John Howington is a thoracic surgeon at St. Thomas who came in to talk to us about lung cancer. Nice to see you.
Nice to see you. Thank you for having me.
I know the majority of the cases are smoking related. Give us the breakdown on who is primarily affected.
So the majority of lung cancer patients are either primary or secondary smoke exposure. That's about 87%. But just over 10% have never smoked in their life. And when there's 240,000 lung cancer cases a year, that's close to 30,000 people a year that never smoked. So it's an important group for us to focus on. But far and away, the #1 cause of lung cancer is smoking.
So that is the greatest risk factor by far?
Yes.
Okay, secondhand smoke, where does that fall in risk factors?
So we saw it mostly in the wives of smokers, because typically adults, when they smoke, try to avoid smoking close to their children, but spouses get most of that secondhand smoke exposure.
What about for those of us maybe who had grandparents who smoked a lot when we were young? You were exposed to that a lot when you were little kids. Are people of my generation at greater risk because of that exposure?
We've not found that among children of smokers, that they are at increased risk. It's primarily been people with occupational exposure, secondhand smoke, so bartenders, people in jazz clubs, the one that used to have smoking in clubs, or the spouses of smokers.
How would you know? What are some of the symptoms? The first thing I would think of would be a horrible cough. What else?
And most of the symptoms of lung cancer are non-specific, so like a cough. Smokers typically have a cough, but this would be a change in the character, or it just lasts longer throughout the day. Someone that never had a particularly chronic cough, just having a persistent cough that lasts for many weeks, and not other symptoms like a cold or a flu. I
see also on the screen you may have chest pain, hoarseness, weight loss.
Yes, these are all signs of advanced lung cancer. And you know, the symbol or ribbon for lung cancer is clear, because lung cancer, until it's advanced, doesn't cause symptoms. There's not a lump, there's no general feeling of being bad until it becomes advanced. So that's why lung cancer screening is important.
And who would be asking for lung screening? You know, what patient population? Obviously, smokers, as a rule, I would think maybe wouldn't necessarily ask their primary care physician to be screened. Would the primary care physician be looking for that?
Well, they both should be a part of the conversation. And so if you're 55 or older and you smoked a pack a day for 20 years or longer, and you're still smoking, or you quit in the last 15 years, then you should have that conversation with your primary care physician. And we know from lung cancer screening trials that you got a 20 to 40% chance of reducing your risk of dying from lung cancer. And we know that lung cancer is the #1 cancer killer in women and men. And for women, it's an even greater benefit. There's a 40% reduction in lung cancer mortality in women that get screened for lung cancer. Higher than for breast cancer screening or for colorectal screening.
Is that fairly new information?
Yes, it's brand new, hot off the press from the World Lung Cancer Congress. There was a 15,000 patient trial in the Netherlands, and that showed in women a 40 to 60% reduction in lung cancer mortality if they were screened.
The best screening tool, it's not an X-ray.
Correct, it's a low-dose CT scan. We knew from trials in the 70s and 80s that chest X-rays are just not sensitive enough. But with a low-dose CT, you can identify lung cancers early, the vast majority in stage 1. And early-stage lung cancer is highly curable. 80 to 90% of patients with stage 1A lung cancer are cured. So with lung cancer screening, we can change the culture, the paradigm of lung cancer. Just like breast cancer, early-stage lung cancer is highly curable.
Are you finding them earlier and earlier with the CT scans?
We are, and so we're seeing a stage shift. Not as fast as we'd like, because not as many patients are getting screened as they should. Less than 10% of people that are eligible for screening are currently getting screened. So that's why programs like this, lung cancer awareness, to get the word out for patients that are at risk to get screened.
What are some of the most effective treatments? Is it targeted therapies, drugs?
So it's stage-specific treatment. So for early stage, stage 1 and stage 2, it's typically an operation. If it's stage 1, it's just the operation and following you closely for any chance of recurrence. Stage 2, it's typically chemotherapy after the operation. For more advanced stages, it's a combination of chemotherapy and radiation, and you're correct. In the advanced stages, very promising findings with targeted therapies, immunotherapy, and so we're seeing, even in the most advanced stages, with current treatment, longer survival, longer periods of remission, and less side effects from the therapy.
That's encouraging to
Yes.
hear this.
A lot
Really
of positive
encouraging.
news in the last decade on lung cancer.
Sounds like it. If people need help in putting out that cigarette for good, what do you recommend?
So there is the 1-800-QUIT number to call. There's also help through cancer.gov, the American Lung Association, the American Cancer Society. All those websites have links to help smokers quit smoking.
If you have a smoker, a heavy smoker in your family, if it's a parent, grandparent, a coworker, do you think it's a good idea to say to them, hey, talk to your doctor about getting a CT scan specifically? I mean, do you think that's good advice?
Yes, I'm actually the youngest of 8, and I have several siblings that fit the criteria. So yes, I talk with them to have a conversation with their primary care physician about getting lung cancer screening.
All right, best place to go for help as far as a resource?
So they go to stthomashealth.com, then go to cancer.gov, and again, the American Lung Association or the American Cancer Society.
All right, thank you. This was very enlightening, and I'm so pleased that you shared the news out of the conference as well. That gives people more hope.
Yes, very, very much a more positive paradigm for lung cancer today.
Okay, thanks so much for coming in and sharing this information. Appreciate it. We'll be back with a lot more after this.